Good day, I am Leila Adrian Rafanan from BSN2C, and for this video, I will be demonstrating how to measure the Fundic height and how to perform the Leopold'S maneuver and how to auscultate the fetal heartbeat.
For the assessment, determine the need for Leopold'S maneuver, assess the client's overall condition, and determine when the client last voided or when was she last tested for urine analysis. Also, determine the date of her last menstrual period. In computing the age of gestation, determine the LMP and the date of consultation. As you can see here, the date of her last menstrual period was on April 17, 2022, and the date of consultation was on October 11, 2022. So we have 30 days in April minus 17 because her LMP was on April 17 equals 13. And in May, we have 31 days. In June, we have 30 days. July, we have 31 days. August, we also have 31 days. September, we have 30 days. And the date of consultation was on October 11. All in all, we have 177 days or 23 weeks and 6 days age of gestation. In computing the expected date of delivery, determine the LMP, which is the April 17, 2022, minus 3 months plus 7 days and plus 1 year. That equals to January 24, 2023. So before we start, we must prepare the materials that we will be needing for these procedures, such as tape measure, stethoscope, small pillow, and a draw sheet for draping. Do not forget to perform proper hand hygiene and provide privacy for the patient.
Good afternoon po, ma'am. I am Leila Adrian Rafanan from NUST, and I will be your student nurse for today. So, bago po tayo mag-start, may I know your name and your birth?
I'm Marila Santa Romana, birthday ko November 29, 1980.
Thank you po, ma'am. So, ang gagawin po natin ngayon ay i-measure po natin yung Fundic height niya, and gawin ko po yung Leopold'S maneuver para malaman po natin yung presentation and position po ng dito sa pog niyo. And lastly po, gagawin din po natin i-auscultate po natin yung fetal heart. Okay lang po ba yan?
Position the patient in a dorsal recumbent position, then place a pillow under the head for comfort. Drape the client with the draw sheet exposed from below the breast to the symphysis pubis. Determine the fundal height using the ulnar side of the palm. Measure the fundal height using a tape measure. Stretch the tape measure across the abdomen's contour to the top of the fundus along the midline. The client's Fundic height is 25 centimeters. And now we will proceed to the Leopold'S maneuver. So instruct the client to relax the abdominal muscle by bending the knees slightly. Use flat palmar surface of the fingers and not fingertips during palpation. For the first grip, we are to determine what lies in the fundus. So stand at the client's side and face the client. Palpate for the size, shape, consistency, and mobility of the fundus fetal part. For the second grip, place your hands on each side of the client's abdomen about midway between the symphysis pubis and the fundus. Move the hands on the sides of the abdomen with one hand placed to steady the uterus. Repeat the maneuver on the other side of the abdomen. For this maneuver, we will be determining where is the fetal back. The third grip is the pollex grip. Continue facing the client and grasp the lower abdomen portion immediately above the symphysis pubis between the thumb and the middle finger of your hand. This is to determine what part of the baby is in the lower abdomen. For the fourth maneuver, face the client's feet and place your hands palmar surface on each side of the client's abdomen. Use both hands and palpate the fetal head using pressing downward gently with your fingertips about 2 inches above the inguinal ligament. And now we will be auscultating the fetal heartbeat. We will auscultate on the side where we palpated the fetal back earlier. Place the bell side of the stethoscope chest piece on the fetus convex portion closest to anterior uterine wall. Listen by pressing in firmly and very gently. Count a full minute holding the stethoscope chest piece. For the evaluation and documentation, document the procedure including the tests performed and resulted in the client record using forms or checklists supplemented by narrative notes. Notify the healthcare facility responsible regarding the results and inform the client regarding the findings. Also, teach the client how to proper follow up and provide other appropriate instructions.